When I was newly diagnosed with diabetes, getting the results of those tests were still on paper. And when I then went to a specialist, she had to reorder those tests. It was easier than trying to find the results or find out who had the results.
L'accès limité aux renseignements sur le patient, où et quand vous en avez besoin, occasionne un manque d'efficacité et des tests faits en double, en plus de retarder les traitements. Pour Julie, infirmière praticienne, traiter des patients atteints de maladies chroniques complexes était difficile, sans accès opportun à l'information sur les patients.
If I need to see a report, I would have to go through the GP and ask for a copy of the report. That would involve me phoning the medical office assistant, making my request, having her speak with the doctor to get permission to have that report sent to me, and then have the report sent, which probably wouldn't be in a timely fashion.
The patient ends up seeing a lot of different specialties. You would have to kind of phone every specialist to kind of find out what happened at each of their clinics, and then the family doctor wouldn't really necessarily know what's going on in all of these isolated clinic visits.
In the old times, it would take 5-6 days to get x-ray results or lab results back.
Le docteur Leitner est le médecin de famille de Lynn à Kelowna, en Colombie-Britannique. Dans son cabinet, le papier est chose du passé et l'accès est transparent.
With the implementation of EMR and associated EHR implementation, we were able to access x-ray results, lab results, not to mention consultation reports on a quite an expedited basis.
Les systèmes de santé électroniques interreliés permettent aux cliniciens de partager l'accès aux renseignements sur les patients avec des prestateurs de soins d'autres établissements.
I can look up all their lab results, including any that have been done by another healthcare professional, which is very valuable to me, especially on an initial appointment, because I can see what I need to order, what the patients had recently ordered, so I don't have to bother ordering that test. Having access to the electronic records, I can go online and see what the patients had recently ordered, so I'm not duplicating orders, which saves the patient time, saves the healthcare system money.
From the hospital perspective, it's really important to have an EHR to see what they got in the community, because now at this point, once they're admitted, I need to make an assessment. Or if I see maybe their admission is a drug-related issue and that I need to stop this drug when they're being admitted and treat them appropriately.
En fait, sans l'accès aux renseignements interreliés sur le patient, les médecins reçoivent en moyenne 2,5 appels par jour de pharmaciens souhaitant clarifier des ordonnances. Chaque appel prend plus de 7 minutes.
Now with the new system, we're able to get specialist reports back almost same day, which definitely improved quality of care for the patients. It improved the time frame that people got care, further testing, everything just sped up exponentially.
I've really noticed the change in the way the doctors relate to each other in terms of the information. They all know they all have the same information. They better understand the decisions that the other physician is making, and then they support that decision.
L'accès partagé à de l'information complète sur la santé améliore la gestion des soins en réduisant les examens faits en double et en augmentant l'efficacité de la pratique. Une autre raison de dire qu'il vaut mieux savoir que de ne pas savoir.